All right, thank you so much for staying with the Monday Report. This is the town hall session that we allow you to ask our guest all the questions you may have in mind. Tonight we're having Dr. Mwachonda Chibanzi, the Secretary General KMPDU, and Seth Panyako, Secretary General Kenya National Union of Nurses. This is 20 days before the nationwide doctors' strike. We'll find out from them what that would mean and why now. Dr. Mwachonda, I'll start with you. You met the CS today, the CS Mutahi Kagwe. Was there a deal?
No deal.
Why
Basically,
not?
That meeting was a meeting where we were trying to tell out the issues. They had requested to see us to know what the issues are. In fact, at the time that we met, we had not yet officially issued our strike notice. So our strike notice was issued after that meeting.
But that was today. He said that today he met some
Yes,
of the unions.
we met them at midday. The press was at 3:30. Our strike notice was delivered at around 3:30 also. So the issues are known to them now. We have initiated the formal process of the strike, and so there are 21 days to get the issues addressed.
21 days now. Let me bring in Seth Panyako on this. Panyako, you know, what is your view on this issue? Because I know the nurses have not called for a strike yet. It's the doctors who are calling for a strike. What is your position on this?
Our position is that the doctors have every right to call for the strike because the issues which they are raising are issues which are cutting across the board. Those issues are actually affecting all health workers. And the nurses union process of calling a national strike is somehow lengthy, and we are in that process. We believe that by Friday we shall have received views from the National Governing Council members, and I believe they will be authorizing me to issue a national strike notice. So by Monday next week, I believe that the government will be receiving a strike notice from the nurses union. So as far as I'm concerned, the doctor's strike is merited, is within the law, and it is only incumbent upon the government to address all issues that are being raised by the doctors' union.
Panyako, when you say by next week nurses are also calling for a strike, the question that comes to everybody's mind is, why now?
These are issues that we have been discussing with the government for a very long period of time. You remember the strike that we went in 2017. Those issues have not been resolved up to now. And the courts, to some extent, are acting like the executive. The courts are very much in a hurry to say that health is an essential service, don't go on strike, give you orders, go and negotiate. And the government comes to court and says, look here, we are willing to negotiate with the nurses. But when you get outside there, negotiation cracks, they break down, there's no negotiation. When you go back to court, the courts are quick to dismiss the matter that the employer is willing to negotiate. And therefore, there's a game of cat and mouse within the court and the executive. So we are saying our issues of 2017 have not been resolved. Now, the issues that have been brought up by COVID-19 have not been resolved. Our people are dying. For example, we have lost 14 nurses that have been confirmed of COVID-19. And we have 2 nurses who have collapsed in Kenyatta National Hospital, and we believe it's also due to COVID-19. That brings to the number to 16. Out of 32 health workers who have died of COVID-19, 16 are nurses. And this is something that we are not taking lightly. We cannot continue to take ourselves to a slaughterhouse. Our public health facilities are now becoming like slaughterhouses. You go to work, you have no personal protective equipment. Where they exist, some of them are not to the standards required, and therefore, and they're not adequate. And therefore, we are saying enough is enough. We want our issues to be addressed once and for all. Yeah. We are paid a risk allowance of 3,850. We are saying we want a risk allowance of 30,000 Kenya shillings because of the level of exposure. But on picture first, before even we go far, I heard somebody say that we need to be patriotic. I want to tell you that there is a group of health workers in Kenya who have not earned salary for the months of October up to now. Homa Bay today are on strike, what we call salary barrette. They have not been paid salary for the month of October. What are we talking about? Yeah. You want me to sacrifice, you want me to have food supplements, which is not being given by the government, and you are not even paying me that salary for me to get those food supplements to protect myself and protect my family. We will not allow, it will not be business as usual.
Dr. Mwachonda, you know, I get concerned when the National Union of Nurses say they are striking maybe next week. You have called for a strike already in the next 21 days. In fact, now it's 20 days. Are you concerned by the impact this will have on ordinary Kenyans?
Trevor, let me say this. And before I answer your question, let me put the reason why we've gotten to this point. This is a memorandum, the Senate Ad Hoc Committee on COVID-19 in April. This is a letter to the CS Health June to discuss these issues. 7th September. This is a letter to the Council of Governors Chairman. And the issues that we have written here, and we say it is urgent to resolve these matters, are what is on the strike notice. This is a memorandum to the 5th Extraordinary Summit, and we gave recommendations. All these issues were put forth. Meetings not forthcoming, communication broken. So it's no longer an issue of the impact. The impact has now been felt on us. 10 doctors have died. And the recommendations we are giving here could have made this situation different. So yes, there's going to be an impact. But, and I'll say this, and I said it the last time I was here, Trevor, when the country is at war, when your soldiers on the front line do not have the armor, do not have the bullets, and they start dying on the front line, you will not start saying, when they retreat, you will not start saying, you're retreating, are you not concerned about our people? Because what's going to happen is this. Those on the front line will die, will no longer be able to take care of you who are now saying the impact. So it's better that we take this route. If these issues are resolved, we will go back, resolved comprehensively. We will go back and we'll protect the front line. But if they are not resolved, we will stay home until such a time that they will think it is important to resolve these matters. So,
Dr. Mochonda, what is the bare minimum you will accept then? Because this afternoon when the CS came out to say that he had a meeting with the UNNHIF, sort of finalizing a deal.
They are finalizing a deal. We've not seen that deal yet. So the bare minimum is what we put forth. These matters are so simple, they're so straightforward, none of them is negotiable. The issue of employment of more doctors. Doctors have died. Doctors are getting sick and going on to quarantine. Doctors are being forced to work on the front line because they do not have symptoms, but they've turned positive, because if they go on quarantine, there's a shortage, it affects service delivery. We have over 2,000 doctors who've completed internship, who've been out of employment for the last 2 years, who are willing and ready to come on the front line to serve Kenyans. So this is no longer a matter of that this is negotiable. Doctors have died since July, and I'd like to say this, even as they conclude that deal on compensation on group life, the doctors who died in July must be compensated. That is what we will take as a bare minimum. July. They must be compensated from July. The issue of healthcare facilities dedicated for frontline healthcare workers, and not just doctors here, because now we're talking of each county, are issues that I put forth here in this letter to the COG chairman, in the memorandum to the summit.
Did you get a response?
No response, Trevor, to this.
Have you had a sitting with any of them?
Trevor, we met the governors in August, September, and after that, they went silent. There was no meeting as a follow-up to address the matters. And at that time when we met, it was because the clinical officers and the nurses had issued a strike threat, and that is when the meeting was convened. But after the strike threat was deemed neutralized, then everybody went back to their usual business. So the situation is this, that we cannot take healthcare workers as if they do not understand their plight. You know, we understand our plight, we understand our role. And let me say what Seth was saying. This issue of patriotism, one, there is no one who is more patriotic than us. I myself have taken part in verifying locally manufactured PPEs across factories in this country, just to make sure that the country is producing quality PPEs for the frontline healthcare workers. If that is not patriotism, then I don't know what patriotism is.
Okay.
And so what I'm saying is this, that where we are, there is nothing negotiable on that strike notice. Those matters must be fully addressed.
Okay.
And to finalize that, we've said employment. We have not said employment of Cuban doctors. Let us be very clear here. Because we hear now there are plans to go and get 500 more Cuban doctors. We will not. If you do that, you're just fueling the fire.
Okay.
Yes.
Panyako, there's a question here for you. Someone says, is it called Lonyo Neil? He says, Trevor, can you ask Panyako if he's aware that UHC staff employed under the national government 3 years contract to support other health workers on COVID-19 have not been paid for 6 months now, regardless of the union stand on the employment status?
On which I'm very much aware that those nurses who are employed on dubious contract called UHC have not been paid, and we have opposed those contracts because they go against the National Employment Policy, they go against the Employment Act 2007, and we have taken quite a substantive number of counties to court, and we have received positive orders from the courts in terms of the court directing that those counties should pay those nurses' salaries, which is equal and approved by SRC with that other health workers are getting at the counties. It is not only the nurses who are on UHC that have not been paid. There are others who have not been paid. The ordinary nurses, like in Homa Bay, all health workers and actually all public servants in Homa Bay County have not received salary for the month of October. Yeah. We have also this group of nurses called BSN interns. These interns have now worked for 2.5 months without salary. And we wonder, when somebody says that we are patriotic, we support, we care about health workers, we know what they are doing a good work, but when it comes to the welfare of the health workers, no one cares about us. This is the time we are saying it is now or never. We must fight for our rights, we must be respected, we must not just people talking by saying you're doing a good job, health workers, you are sacrificing, and yet when it comes to payment of salaries are not being paid. And that's why we are saying we need the Health Service Commission to resolve some of the simple issues like non-payment of salary, non-remittance of statutory deductions, the issue of medical cover, the issue of life insurance cover, we call group life insurance cover, the issue of declaring of COVID-19 as a health hazard, so that workers who go through, who die, it's not, Ombiche is not only health workers who are dying at the place of work. Yeah. We have other public servants and other private workers who are dying at their place of work because of people who come and infect them. Yeah. All these people have the right to be compensated, but we have a government that is not caring about that. No one is talking about the plight of health workers in this country. Everybody is talking about their political expediency, especially when you look at the BPI today. We gave views, and Kenyans said they wanted the health service to be taken back with the national government. We as health workers, we said no. Health services were not better at the national government. What we wanted an independent constitutional commission to manage health sector. What are they doing? The politicians, they have said, no, these health workers, they are people, they will continue managing patients as we do the politics, so let us give them a statutory body. Yeah. A statutory body that cannot resolve the issues that are currently in health sector. The only solution that we have that can resolve problems in the health sector, 95% with one stroke of the pen, is a constitutional body called the Health Services Commission. And I can tell you, if we go on strike, we will not go back until that PPI thing has a Health Service Commission that is proposed to be established as a constitutional body.
Okay. Dr. Mochonda, there's a question here from COFPAC official, that's how they call themselves in their Twitter handles. They're saying when healthcare workers choose to go on strike, does it mean that they're calling on death upon Kenyans?
Let me say this, Trevor, and I think I'll say this again, that healthcare workers are humans, one. Two, as healthcare workers, we offer service. But for us to offer service, we are supposed to be facilitated, we are supposed to be taken care of. And our welfare is a responsibility of the government. And let me remind them that the ones who are supposed to take care of us either took a Bible or a Quran and swore to God that they shall uphold the rights of the citizens and uphold the Constitution. So we are citizens. they also took an oath. So their oath mandates upon them to make sure that our rights to offer service is provided. So that death is not upon us. The entrepreneurs who stole funds, PPEs have been stuck for 2 months, healthcare workers are dying. Those are the people Kenyans should be questioning, not us, because we've been on the front line and it has cost us 10 doctors. Do you know the impact of losing 1 doctor, Trevor? 1 doctor, the ratio is 1 to 10,000. So if you've lost 10,000, you're talking of 100,000 Kenyans who now have lost access to healthcare services. The impact on the ground is that you will get an increase in the waiting time, be it surgical services, be it services at the clinic. And these are specialists that take a minimum of 3 to 6 years to train. So for you to replace that person, you're talking of the next 3 to 6 years of replacing that. So these 100,000 are missing that service for that period. That is the impact. So the questions should be asked the right people, not us.
Okay.
Yeah.
And Dan Alila is asking a question here, Panyako, and I'd like both of you to respond to it. It's still along the same lines. He's saying doctors' strike amid the pandemic is like a mother abandoning her child because of hunger. Where is the humanity? Doctors' medical gears are supplied fully by the government and excuses are just blindfolds. Panyako, aren't you receiving these PPEs? Because we've seen several donations being done. Is it that the PPEs are not of good quality or are they insufficient?
You know, Ombincha, when you hear that KEMSA is holding personal protective equipment worth 6.5 billion, it has not been released. Where else do you expect the public health facility to be getting personal protective equipment from? When those that have been, the prices were extrapolated and they were bought at astronomical prices that are not within the market margins, are lying there at KEMSA. What I'm saying is that we are not people who can just come here and start complaining that we don't have personal protective equipment. The rate of infection among health workers should be a pointer that we do not have personal protective equipment. And those that are being haphazardly being thrown here and there by different owners, we needed those personal protective equipment to go to health workers in their facilities to be channeled through some kind of organization, so that if they are going to go through the Ministry of Health, let them go through the Ministry of Health. But we don't want to hear that somebody here is donating something, is going direct to health workers. We don't even know the quality of those products that are going to be used by the health workers. Somebody who is saying that we are saying things we don't know must understand that I'm talking about 16 nurses who have passed on in their line of duty because of lack of proper personal protective equipment. And that's not something going to take lightly. Secondly, I'm talking about 700 nurses who are currently infected by COVID-19. And I can tell you, Mbicha, if testing was to be done on all health workers in Kenya, you'll be surprised to learn that actually the rate of infection can even be at 60%. So we must do something as leaders of the health workers. There are other issues. You cannot tell us to continue working when our issues are not being addressed. It is very important that members of the public understand that we did not take an oath. I did not take the Nightingale oath to go and kill myself. We took the Nightingale oath to go and save life. And in the process of saving life, there are other players that must come in. We must have the employer, in this case the government, come in and do your part. Pay salaries in time. Employ adequate staff. Today we are saying we have about 7,000 nurses who are not employed outside there. They have no jobs. And here the rate of those nurses who are being infected and who are going to quarantine is very high. The rate of the nurses now who are dying is just going up. We have the nurses who are retiring, those who are leaving service by natural attrition. Before COVID-19, we had a serious staff shortage of nurses within the public sector. So we are telling the government, hire these 7,000 nurses. And these other nurses that you have put on dubious contracts, that you are paying 15,000 shillings, others 20,000 shillings, we want them to be converted into permanent and pensionable terms, and we want them to be put under comprehensive medical cover as well as group life insurance. And as Dr. Mwachonda has said, all those nurses who have died in their line of duty, they must be compensated. That's not as something that's out here for negotiation. We want the families of those nurses that have died to be compensated so that their children, some of the nurses have left very young families, and they are the only breadwinners. But people don't care. People are busy reading numbers outside there, telling us how they are sending message of condolence to the health workers who are dying, and yet they are not telling us what mechanism they are put in place to ensure that the families left behind do not suffer because of the armies that they have released to go and fight in the war, as Mwachonda has said. So as far as we are concerned, we are stopping at nothing this time. There will be no turning back.
Trevor,
yeah, go ahead.
Let me respond to the issue of PPEs. Let me say this. And we are really glad that the Emergency COVID-19 Fund Board was set up, because so far it is what has helped healthcare workers up until this point. And I'm saying this because I sit in the technical advisory of the Health Committee. And what we've done there is that it was a supplementary effort to the efforts of the ministry and the county governments. We took charge of the 68 isolation and treatment centers in this country and gave PPEs, quality PPEs. In fact, even had to go around several factories to ensure that the PPEs that were being manufactured locally were of the right standard. And you know, the impact of that is that the country has been able to export those PPEs to other countries in Africa.
Yeah.
So 68 isolation and treatment centers where you have COVID patients are taken care of. But you still have level 2 facilities, level 3 facilities, level 4 facilities that counties and at the national government, those that are not isolation, were supposed to have been provided with PPEs. Do you know what has happened, Trevor?
Yeah.
The government is now coming out to say that we have enough PPEs because COVID fund has provided these PPEs on these specific facilities. So on the other side, then you have county governments that do not want to procure from KEMSA initially. Apart from the whole issue of the price, was that people had seen this issue of PPEs as an issue of making money. That is the reality, Trevor. Let us not lie to one another here. Okay. And so we started getting substandard PPEs in circulation. And we know out of this initiative that we've had here, we've been able to tell our healthcare workers on the ground, should you see a substandard mask, should you see a substandard surgical gown, should you see a substandard shoe cover, or goggle or face shield.
Do they know what to look out for?
Yes. Okay. This is information we've passed to them. We've done it even through very many forms of communication, through videos, so that you're able to assess the PPE at that ground level and the facility level. And what has come out, and it's all over. You saw in Kisumu, you saw in Homa Bay, you even saw it, you even received reports in Mombasa of substandard PPEs. Across the country, we saw these things, and the healthcare workers were crying. And the result was that we saw infections increasing and increasing and increasing.
Okay.
So let us not lie, and to respond to him when he asked that those PPEs are still insufficient and inadequate in the other facilities apart from the 68 isolation and treatment centers for COVID.
All right, gentlemen, I have to take a quick break here. When we come back, there's still a lot of questions coming through. Kenyans are just pretty much concerned about what's happening, what's going to happen should you call the strike. The Kenya National Union of Nurses says as soon as next week, they'll also be calling for a national strike. We'll see how that turns out. But keep your questions coming at Trevor Mbiji at Citizen TV Kenya. Use the hashtag Monday Report. We're back in just a bit.